Hi, I have a nice challenge for you today. Let's imagine you see a shoulder patient and you do a functional examination, and one of the things you find in the examination is clear weakness on resisted abduction, maximal isometrical contraction. What could be the reason of this weakness? Well, actually there are five different options. And one option would be a total rupture of the supraspinatus. A second option would be a partial rupture of the supraspinatus. But there is a difference in the clinical image. When there is a total rupture, then your resisted test is not painful, but you find extreme weakness, most likely force 0. When there is a partial rupture, then your resisted test is painful and weak, but not force 0. There's still some force available. Another option is a problem with the axillary nerve, and in that case, patients often describe some sensory deficit in this particular area. Another option is a mononeuritis of a suprascapular nerve. And of course, this nerve is innervating supraspinatus and infraspinatus. So in that case, you're going to find in your examination not only weakness on abduction, but also weakness on lateral rotation. Another nervous problem could be too much pressure on the C5 nerve root by a disc or an osteophyte, resulting in motor deficit of C5 structures. That would be weakness on resisted abduction, weakness on resisted lateral rotation, and also some weakness on resisted flexion. Actually, all those options, they all have a typical clinical image. And this is so important in musculoskeletal medicine. It's all about collecting puzzle pieces, elements from the history of the patient, the inspection, the functional examination, and then you put all those puzzle pieces together, and only then you can reach a relevant diagnosis. And this is exactly what you will learn during our courses in musculoskeletal medicine. So keep that in mind, it's all about puzzle pieces. So, we had 4 reasons for weakness until now. Supraspinatus, total rupture, partial rupture, axillary nerve problem, suprascapular nerve problem. But there's also another option, and this is the less favorable option, when the patient has a cancer, for instance, metastasis in the acromion, then of course you're also going to find weakness on this resisted test. So far, so good. So let's have a look at the summary.